Good morning all, I am Dr. Neeta. Today we'll see the sphenoid bone. Sphenoid is an unpaired bone and it is pneumatic because it has got air sinuses, that is not the sphenoidal air sinuses. And the shape of this bone is irregular. It is located in the base of skull. In this figure you can see the yellow shaded bone is the sphenoid bone. Anterior to it is the frontal and the ethmoid bone, and posteriorly the basi-occiput and the petrous part of the temporal bone, and laterally on sides the squamous part of the temporal bone and the parietal bone. So the shape of the sphenoid, it resembles a bat with its wings stretched out, and it has a central body, 4 wings, the 2 greater wing and the 2 lesser wings, and 2 pterygoid processes. In this figure you can see the body that is represented by the blue shaded area, the 2 lesser wings, the green shaded area, the greater wings, the brown shaded area, and the 2 pterygoid process represented by the yellow shaded area. Coming to the details of the body of sphenoid, body has got 6 surfaces and the sphenoid air sinuses. The surfaces of the body are the superior, inferior, anterior, posterior, and the 2 lateral surface. Coming to the details of the superior surface of the body of sphenoid. The superior surface has got the following features from anterior to posterior. Most anteriorly is the jugum sphenoidale. So this portion is the jugum sphenoidale. It is a smooth area that articulates with the posterior margin of the cribriform plate and related on each side to the gyrus rectus of the cerebral hemisphere and the olfactory tract. Posterior to the jugum sphenoidale is the sulcus chiasmatis. It is a transverse groove. The optic chiasma lies just above the sulcus chiasmatis. Laterally it leads into the optic canal. So this is the sulcus chiasmatis and laterally it leads into the optic canal. Posterior to it is an elevation known as a tuberculum sellae. Again posterior to the tuberculum sellae is the sella turcica. It's a depression or the depressed area behind the tuberculum sellae. The hypophyseal fossa, it is the deepest part of the sella turcica that lodges the pituitary gland. And again posterior to the sella turcica is the dorsum sellae. It's a square plate of bone. The superior angles of the dorsum sellae will project laterally into the posterior clinoid process. Now posterior to it is the upper part of the clivus. It is a sloping behind the dorsum sellae and it supports the pons. So these are the features of the superior surface from anterior to posterior. Now coming to the posterior surface, it is rough and articulates with the basilar part of the occipital bone. Now the anterior and the inferior surface. In the anterior surface, in the midline, there is a triangular crest and that is known as a sphenoidal crest. Sphenoidal crest articulates with the upper part of the posterior border of perpendicular plate of ethmoid bone. In the inferior surface, there is a midline triangular spine and that is known as a sphenoidal rostrum that fits into the groove between the ala of Vomer. Now what is a sphenoidal concha? They are thin plate of bone. Both anterior and inferior surface of the body on either side of the midline are covered by thin plate of bone and that is known as a sphenoidal concha. Coming to the lateral surface, it unites with the greater wing and the medial pterygoid plate. So it unites with the greater wing and this is the medial pterygoid plate. Upper part of the lateral surface, there is a carotid sulcus that lodges the internal carotid artery and the cavernous sinus. So you can see the carotid sulcus here. On the lateral margin of the carotid sulcus and the posterior end, there is a projection that is known as a lingula. And that lingula lies above the posterior end of the pterygoid canal. So this is the pterygoid canal and this is the lingula. the sphenoidal sinuses. There are two large air spaces in the body of sphenoid. They are the sphenoidal air sinuses. They are separated by a septum and they are rarely symmetrical. What are the relations of the sphenoidal sinuses? Superiorly, it is related to optic chiasma and the pituitary gland. Laterally, the internal carotid artery and the cavernous sinus. So now let's see the greater wing. The greater wing of sphenoid has got three surfaces: cerebral, lateral and the orbital surface, and it has got margins. First, about the cerebral surface. So the cerebral surface, in the cerebral surface you can see some foraminas. It is concave and it forms part of the middle cranial fossa. And the cerebral surface is related to the temporal lobe of the cerebrum. The foramina seen here are foramen rotentum that transmits the maxillary nerve. Then posterolateral to the foramen rotentum you can see the foramen ovale. Foramen ovale transmits the mandibular nerve, accessory meningeal artery, lesser petrosal nerve and the emissary vein. And lateral to the foramen ovale is foramen spinosum that transmits the middle meningeal artery and the nervus spinosus. So these are the features of the cerebral surface of the greater wing of sphenoid. Now coming to the orbital surface. So this is the orbital surface. The orbital surface is quadrilateral in shape and it forms part of the posterior part of the lateral wall of orbit. There is an upper serrated edge and that upper serrated edge articulates with the orbital plate of frontal bone. And there is a lateral serrated margin that articulates with the zygomatic bone. And there is an inferior smooth border that forms the posterolateral boundary of inferior orbital fissure. So this is the inferior smooth border, and there is a medial sharp margin that constitutes the lower boundary of the superior orbital fissure. This one. And there is a projection from this medial sharp margin that provides attachment to the common tendinous ring. Now coming to the lateral surface. Lateral surface is convex from above downwards, and there is an infratemporal crest that divides the lateral surface into an upper temporal and lower infratemporal surface. The temporal surface forms part of the temporal fossa and provides origin to temporalis muscle, whereas the infratemporal surface forms a roof of infratemporal fossa. Infratemporal surface also gives origin to upper head of lateral pterygoid muscle, and it also possesses openings of the foramen ovale and foramen spinosum. Now, in the lateral surface, the posterior end of the lateral surface, there is a projection, and that is known as the spine of sphenoid. The spine of sphenoid has got some important relations and attachments. The tip of spine gives attachment to sphenomandibular ligament, and medially the spine is related to the chordae tympani nerve and the auditory tube. Laterally, the spine of sphenoid is related to auriculotemporal nerve. So these are the details of the lateral surface of the greater wing of sphenoid. Now about the borders. You can see the borders in this figure. There is a parietal margin, not borders, the margins. There is a parietal margin that is at the tip of the greater wing. Then there is a posterior margin. Posterior margin extends from the body of sphenoid. It extends from the body of sphenoids to its spine. That is the posterior margin. The medial half of it forms the anterior boundary of the foramen lacerum and receives opening of the pterygoid canal. The medial half, and the lateral half articulates with the petrous temporal bone. Now the lateral margin. This is the lateral margin that extends from the spine to the tip of the greater wing. It is also called the squamosal margin because it articulates with the squamous part of the temporal bone. Now coming to the lesser wings. It is triangular in shape and extends laterally from the anterior-superior part of the body. It has got tip and two roots, anterior and posterior, and two surfaces and two borders. So in this figure you can see this is a tip, this is the anterior root and this is the posterior root. Then there is a anterior border and the posterior border, superior surface and the inferior surface. The tip of the lesser wing is the lateral end of the lesser wing and it is situated near the lateral end of superior orbital fissure. Then the two roots connect the lesser wing to the body of sphenoid and it encloses the optic canal. Optic canal transmits the optic nerve and the ophthalmic artery. Now the superior surface forms the posterior part of the floor of the anterior cranial fossa and the inferior surface forms the superior boundary of the superior orbital fissure and the posterior part of the orbital roof. Now the anterior border articulates with the posterior border of the orbital plate of the frontal bone and the posterior border is free. Its medial end of the posterior border forms the anterior clinoid process. So you can see this is the anterior clinoid process. Now about the superior orbital fissure. It is a triangular slit-like communication between the orbit and the middle cranial fossa. The boundary is medially by the body of sphenoid, apex formed by the frontal bone, superior boundary formed by the lesser wing of sphenoid and the inferior boundary by the greater wing of sphenoid. You can see all these boundaries in this figure and it transmits number of structures. The structures which enter the orbit like the upper and the lower division of the oculomotor nerve, trochlear nerve, the three branches of the ophthalmic division of the trigeminal nerve, abducens nerve, then the orbital branch of the middle meningeal artery, etc. And the structures which appear from the orbit, the superior and the inferior ophthalmic wings, the recurrent meningeal branch of the lacrimal artery. Moving on to the pterygoid processes. They are two in number on each side and they descend vertically downwards from the junction of the body and the greater wing of sphenoid. Each pterygoid process consists of a lateral and a medial pterygoid plate. So these plates will unite anteriorly in the upper part to form a fossa to enclose a fossa and that is known as the pterygoid fossa. Whereas in the lower portion it is not united, hence it forms a pterygoid fissure in the lower portion. Coming to the lateral pterygoid plate. The lateral pterygoid plate has got two surfaces, a lateral surface and a medial surface. The lateral surface of the lateral pterygoid plate forms the medial wall of the infratemporal fossa and gives origin to the lower head of the lateral pterygoid muscle, whereas the medial surface forms the lateral wall of the pterygoid fossa and the medial surface provides origin to the deep head of the medial pterygoid muscle. The anterior border forms the posterior boundary of pterygomaxillary fissure and the posterior border is free. Now coming to the medial pterygoid plate, it has got two surfaces, the lateral and the medial, and two borders, anterior and the posterior. Lateral surface forms the medial wall of the pterygoid fossa and the anterior border articulates with the posterior border of the perpendicular plate of palatine bone. Now coming to the posterior border of the medial pterygoid plate, the upper end of the posterior border splits to enclose a fossa and that is known as the scaphoid fossa. And there is a tubercle seen at the upper end and that is known as the pterygoid tubercle. Now there is a hook-like process at the lower end and that is known as the pterygoid hamulus. So this is the pterygoid hamulus. Pterygoid hamulus. The tendon of tensor palati winds around this pterygoid hamulus. Also, the superior constrictor muscle and the pterygomandibular raphe are also attached to this pterygoid hamulus. Now, in the middle of the posterior border, there is an angular process projecting and that is known as a processus tubaris. So, the posterior border above this processus tubaris is called the notch of auditory tube. And this process and the notch supports the medial end of the auditory tube. So that's all about the pterygoid process. So in the anatomical position, the sphenoid bone, the hypophyseal fossa faces upwards Pterygoid processes descends vertically downwards, and the opening of the sphenoid sinuses faces anteriorly. So that is anatomical position. So with this I conclude. Thank you.